there, welcome to Foundations with the Fellows. Today I will be teaching how to treat an exhaled first rib. So first I just want to show you hand placement on the skeleton. So for an exhaled first rib, remember what's happening. The rib is stuck down in the front and up in the back. We're going to be using two mechanisms to oppose these forces. So in the front, we'll be using muscle energy, and I'll talk about what muscle we're using to pull the rib up. But in the back, you're creating a fulcrum with your hand by placing your hand on the superior posterior portion of that first rib to pull the rib down in the back, which causes the rib to go up in the front. Alright, so to treat an exhaled first rib, let's say that Phil has an exhaled first rib on the left. What we want to do is create a fulcrum, like I just said. So what muscle can we use in order to engage that first rib and help to bring it down in the front? Yep, you guessed it, it's the anterior scalene. So to engage the anterior scalene, we'll have the patient push or flex their head and neck up into their hand. So have your patient place their hand on their forehead. There we go, perfect. I'm using one of my hands to place so the patient can push up into my hand with his head and neck. The other hand I'll be placing on the posterior superior portion of that first rib in order to create the fulcrum. And again, we'll use respiratory augmentation. So have your patient breathe in, hold their breath on inhalation. As they hold, you want to have the patient push their head and neck up into your hand. Good. And at the same time, you're pushing inferiorly on the posterior part of that first rib. And then exhale. As they exhale, you're going to resist that exhalation motion. So again, have the patient breathe in, hold their breath on inhalation, push their head and neck up into your hand to engage the anterior scalene. At the same time, you are pushing inferiorly on the posterior part of the rib. As they exhale, you are continuing to push inferior on the posterior part of the rib to resist that exhalation motion. So one more time, have your patient breathe in, hold an inhalation, push their head and neck up into your hand to engage the anterior scalene, and you're pushing inferiorly on the posterior part of the rib. Good. And breathe out, resist that motion. And then of course, you'll go back, have your patient breathe in and out, and recheck to make sure that you corrected that somatic dysfunction.